Hello and welcome to HDtv Health District Television, brought to you by the Southern Nevada Health District. I'm Brian Gresh. We're going to turn our attention now to the district's Healthy Refugee Program. Each year, several hundred refugees relocate to Southern Nevada to begin new lives. No doubt it takes courage to begin again, thousands of miles from home, arriving in a new land with different customs and languages. These new arrivals are assisted through the federal government's Office of Refugee Resettlement. As the district's Margarita DeSantos explains, refugees are different from immigrants.
An immigrant is coming to our country usually to improve their economic and their family's economic well-being. They may be coming from countries, say for example, the Philippines or Mexico or South America. Refugees are from countries that our government has identified. These are countries in which individuals are suffering political or religious persecution. Currently we are getting some refugees from areas such as Iran and Iraq, specifically individuals that might have helped our military.
Refugees then have been identified, qualified, and screened through the federal government's Office of Refugee Resettlement before they begin their journey to Nevada. Here, Catholic Charities is known as the only official refugee resettlement agency and is the reporting agency for the program. The Southern Nevada Health District, in turn, has a contract with Catholic Charities to supply any medical screening requested. Keep in mind that most have already undergone screening in the country they left or at a refugee camp before departing for the U.S.
When refugees are resettled in this country, they are eligible for a screening exam with health history and some testing. It's not mandatory, it's voluntary whether they choose to accept that or not. Our big purpose for participating in this was to screen for communicable diseases, and if a refugee were to test positive for a communicable disease, to get them into the appropriate setting. Normally one of the Southern Nevada Health District clinics, in the example of a TB, for follow-up, further evaluation, and or treatment if needed. Again, most of our refugees, before they come over, do have some level of screening. They do have some kind of an exam. They do receive some immunizations prior to their departure.
Medical screenings in Southern Nevada are performed by licensed public health nurses supplied by the Health District. They follow strict federal guidelines, ensuring the exams and history are carried out by licensed healthcare professionals.
There is no substandard medical screening going on here. Nurses, especially nurses that have a bachelor's degree, and our nurse that is over this program does have a bachelor in nursing degree. We are trained. That is part of our training. We learn to do a nursing physical, and that is what we do. That is in our protocol. We also have a medical director that is available to us in case our nurse should have any questions. We do not provide any primary care services. The health department is not in the business of providing primary care. Should a client need primary care services, they are referred to a physician in the community that is licensed, that takes their particular coverage and or hopefully speaks their language. We're not always able to match them up with someone that speaks their language.
Refugees starting a new life have a lot of ground to cover in a very short time. Federal financial support, including money for medical coverage, lasts only about 8 months. In that time, they must find a place to live, a job, and move forward on their journey. In order to qualify, rest assured they have already undergone much more health scrutiny than any casual visitor to our area.
And again, you don't want to alarm the public, our general population, in terms of refugees coming in here, because, again, communicable disease does not discriminate. We can get it from any visitor that steps off a bus, a plane, or a train. And we don't screen our visitors when they come in.